I would divide them into two kinds. One would be the analgesic creams, whose sole function is to provide a topical pain relief. There's another kind which is joint creams with glucosamine sulfate or some joint supplements within the cream itself. So in the first group, it largely acts as a topical painkiller. Okay, I would advise my athlete patients to apply this cream half an hour prior to their sporting activities as a form of static warm-up. After their runs or after their sports activities, once they've cooled down, after their shower, everything has dried off, apply this cream once more. This basically has a local anti-inflammatory and analgesic effect. It does provide comfort to the athlete after their runs. So that's the first type of cream. Now there's a second type of cream which, in addition to providing what I've just mentioned, they contain joint supplements, most commonly glucosamine sulfate. There are some scientific evidence and scientific research out there which have shown that actually glucosamine sulfate can be absorbed through a transdermal route, meaning it can be, to a certain extent, be absorbed through the skin rather than being absorbed solely through oral means. So this second kind of cream does, in theory, does two things. Number one, of course, a local painkiller kind of effect, and number two, acts as a source of absorption of glucosamine directly into the area where the cream is applied. So I think these creams are relatively new. They have mid-term results of, I would think, about 4 to 5 years. So for longer-term results, I think we will still have to wait a while. But I think there's actually no harm trying these creams and testing out the efficacy on your own. In my own personal opinion, I do not think they are antagonistic to each other. In fact, I think they are very complementary. So for example, if I prescribe a patient cream with glucosamine, it does not mean I do not give them oral supplements. I actually do continue them on oral supplements in combination with a locally applied cream. And I find that in that way, with the two different routes of absorption, in my own personal experience for the last 3 to 4 years, I find that this technique works much better than having isolated ways of taking glucosamine. So for example, either taking it orally or just applying the cream. So in summary, I think if you combine them together, I think they work much better together.